Hi, my name is Dr. Taylor Van Wyboom. We're going to talk about knee pain, a non-drug, non-surgical protocol for relief. So a little bit about myself. My name is Dr. Taylor Van Wyboom, like I said. I've been in practice since 2011 here in Ames. I graduated from Palmer over in Davenport. I played football in college. The only reason I even mention that is because I've had a lot of knee pain in my life, so I can relate to knee pain. I know what works for knee pain because I've had it chronically since playing football. And in our office here, traditionally what we use is what's called functional medicine and functional neurology protocols to help our patients, specifically with chronic issues. So a lot of the stuff that we do relates to chronic problems. So that's where knee pain comes in. It's a chronic issue for most people. So this is just a little disclaimer. Things at our office are constantly changing. One of the things that we hold to is what's called Kaizen, constant improvement. So if you're watching this video and you come in and things are a little bit different, the reason for that is that we've added something better, or we're doing something better than we were doing yesterday. So if we're changing things, it's for the better, it's not for the worse. So if something on here is a little bit different when you come in the office, that's because we've improved it. What you'll see is the average doctor is 17 years behind on current research and technology. We don't want to be one of those doctors. We want to be on the forefront doing what's cutting edge, what's actually working today, now. So, case in point, we're adding a new therapy in our office called PEMF, Pulse Electromagnetic Fields. Really, really interesting, cool things. Has a really great healing factor through it. You can do a Google search on it. Basically, PEMF was developed by NASA because they found that the Earth had a specific magnetic frequency that had a healing factor. So what they did is they put it in the spaceships to help with astronauts and not deteriorating in space, and they found it works on Earth too, but even better because we're on Earth, we already have those natural things. So that's just an example of how we're constantly changing, because that won't be in the slides through here, but it's something that we're getting this month just to get better results with our patients. So what we'll go over today is we'll go over a knee overview with the musculature, the muscles, the neurology as far as that's concerned, why you might have knee pain, and what we're looking at specifically. An exam, which we'll do in the office, and what that looks like, therapies and procedures that we use, and then frequently asked questions. So here's the knee in general. So what you have is this is the femur right through here. This is the patella, or just the kneecap. And this is the tibia, which is basically the plateau which it sits on here. So the bottom part would be the tibia, the top part here would be your femur, where the knee comes together, and then you have a long slender bone here called the fibula. So all this works in conjunction. You have ligaments on the sides and either side, so your LCL, your lateral collateral ligament, your MCL, your medial collateral ligament, your ACL, everybody's heard of, PCL, which is posterior collateral ligament, and then you have your meniscus in through here, which is a lot of issue comes with knee pain and meniscus. And then of course articular cartilage on the joint itself. So this is just an x-ray of a knee. So if we take a picture of your knee, this is a healthy knee. This is what we'd like to see. So like I say, femur in through here, tibia here, big bone in the lower leg, fibula here in the lower leg, skinny part on the lateral aspect, the outside aspect, and then you can see a little shadow of the patella or the kneecap right there. Now you can't see soft tissue on x-rays, so what you have here, you can just see joint space. So that's a good meniscus. You want to see that space. Typically, what you'll see somebody with knee pain is they'll have the medial aspect through here where the meniscus is supposed to be really, almost bone on bone. Which, FYI, bone on bone is not a death sentence as far as you have to have knee surgery. We can help people with bone on bone. You can regain this articular cartilage. You can regain meniscus under proper circumstances, and that's what we'll go over here. So the muscles of the knee, you have your vastus medialis, vastus lateralis, rectus femoris, you have your suprapatellar tendon, infrapatellar tendon, you have muscular down through here. Now what we really want to hit on, most people know about the quad muscles through here in the front and the thigh. What we want to hit on is if somebody's looking at your knee and they're only looking at the front part of your knee, they're missing half the story. There's more than one side to the knee than the front aspect. So you really need to look at the back aspect. And when we're talking about the back aspect, there's more muscles than just this on the back part of the knee, of course. But this is a huge factor in knee pain. It's called the popliteus. And if this muscle, this area is never addressed, never taken care of if you have knee pain, It has to be. Absolutely has to be. And that's one of the things we focus in on with our knee pain patients. So we just want to touch on that so it makes sense when you come into the office and we say, hey, we're going to work on the popliteus in the back of the knee. It's very, very important. You can reference this so you can understand why. So this is just showing some of the neurology, some of the nerves that come down and innervate the knee. So you have all these nerves come from the lumbar spine, low back spine, also from the sacrum, pelvis area, come down, form the sciatic nerve and other nerves, of course, that innervate the knee. So a lot of knee pain can actually come from the brain or from the low back or from the pelvis itself. So looking at those aspects as well so we can make sure there's no complicating factors. We've had people come in that all we have to do is adjust their low back and their knee pain reduces incredibly. There's other aspects that we have to work too, but that's a huge aspect that you have to take care of if you want to help somebody with knee pain. If you're looking not to have surgery, if you want to, keep the knee that you have. One thing that's really interesting is called particle disease. So, you Google this, like I say, it's just called particle disease. What you'll get, let me go back to a picture of the knee on x-ray. So when they give you a knee replacement, they cut off here and they cut off here and they replace it with artificial knee. What they're finding is these artificial knees or shoulders or whatever it is, hip, over years is causing what's called particle disease. So these replacements break down over time just like a regular joint breaks down over time. The problem is it's not organic matter. It's not you. So your body recognizes it as foreign, and these particles go throughout your body and can cause huge chronic illness, chronic pain. So look up particle disease. Whoever you've talked to about knee pain, whether it's your surgeon, your regular medical doctor, whoever, I'm sure they've never mentioned that, but that's becoming a huge complicating factor. The problem really lies in that as long as a knee replacement or joint replacement kind of falls under certain specifications, it doesn't have to be necessarily tested to see if it reacts negatively with the body. So particle disease, you're going to really, really want to look at that because that's a huge negative factor with any kind of replacement. Obviously, you want to avoid chronic illness, chronic pain, at all possible. So, what does our exam look like? So, we'll look at the feet, because they're really the foundation for the body, as well as the knee. So, look at the feet, whether we need to add some arch support, whether there's some adjustment that needs to be done with that. We also look at the ankle. Past injury, are there any misalignments there that we need to take care of, correct? The knee, we talked about some of the musculature, like the IT band, TFL, tensor fascia lata, vastus medialis, vastus lateralis, the adductor muscles, which bring the knee back in or the leg back in, or the abductor muscles that bring it back out, the patellar tendons, infra and supra, and the popliteus. We also check the hips and pelvis for alignment, like we talked about, because you can definitely get complicating factors in the knee from either neurological issues or decreased mobility, functional actual issues. Lumbar spine, looking at the nerves there as well. We might do some possible imaging as x-rays to, just like that picture of the knee that you saw right there, to see what yours actually look like. So we can give you a better, possible care, what your care might look like compared to somebody else that doesn't have that much knee degeneration. Because it will take longer for somebody with more knee degeneration to get out of pain. It's just, that's the way it works. And then brain-based therapy, a lot of this stuff can actually come from the brain too. So we don't usually have to do too much of that, and that's part of our functional neurology protocols that we do in the office. But we check that aspect too to see if that's causing or contributing to part of your knee pain. So the therapies, like say, the orthotics, we consider therapy, the Achmed, which is a machine we'll talk about here in a second, rapid release technique, spinal and extremity adjusting, and anti-inflammatory products for decreasing inflammation and then increasing joint health. So orthotics, just what you think an orthotic is. We're going to look at the foot to see if there's any flat feet, high arches, issues with the tendons through here, any kind of support that needs to be put into the shoe so you can actually locomote like you're supposed to, walk like you're supposed to, take as much pressure off that knee. Look at all those aspects. We also use what's called the Achmed. So this right here is just a paper of a study that was done with the Achmed and how it decreased knee pain. So if we use a machine that decreases knee pain just by itself, and then we add in all these other things that help with knee pain, we get really, really good results. And that's what our goal is to get really, really good results. We also use the rapid release, and what this thing does specifically for us on what we're looking at here is decreasing adhesions and scar tissue, getting the muscles relaxed to a point, because if you have any kind of tight muscles, like I say with popliteus, that can definitely decrease functionality of the knee. So the rapid release is huge, increasing mobility and decreasing pain. So now PEMF would fall somewhere in here as far as when we're talking about therapies as well. We touched on that a little bit at the beginning, but like I say, Google that. It's really interesting thing as far as pain goes, or just health in general. Like I say, spinal and extremity adjusting, the nerves basically from T11 to L1, L2 innervate the knee. So that's an issue you need to look at. And then you can have biomechanical issues as far as the pelvis goes, or things with the feet, or you can adjust the knee itself if there's any kind of rotation. So interesting thing about the knee, you have a lot of people that maybe didn't play sports, don't exercise, sit at a desk all day, but have meniscus tears. And you think, well, how in the world does, Jane Doe have a meniscus tear and she doesn't really do anything? That's part of the problem, but what you get is if you have rotation down here in the tibia, so like say that bottom part, and the knee comes together like this, tibia on bottom, femur on top, and you get some rotation through here either on the tibia, or it can happen in the femur. What you get is you get torsional pressure on that meniscus, and then you walk on that with that torsion pressure, and over time that will tear your meniscus. So if we can get the tibia and the femur back in proper alignment, we'll take that torsional pressure off the meniscus, and it'll be able to heal and avoid the tearing of the meniscus as well. So just things we need to look at, because we want to check all avenues to make sure we can get you doing well. Anti-inflammatory products, so we use different things in the office. Like say this could change, if we find something better, be using something different. So the EFAC, which is esterified fatty acid complex, is really great. It's an anti-inflammatory cream that actually absorbs through the skin to decrease inflammation at the joint. It's obviously not medicated or anything like that. It's all natural. Osteoven, which is just a really good product for joint health and bone. So we use that a lot of times, and other things as well. So frequently asked questions. So here are a few frequently asked questions that we'll go through, just to hopefully calm your mind or answer any questions you might be having. So do the therapies hurt? And just in simple terms, no, not at all. All the therapies are meant to actually feel good. The Achmed works at a suboptimal sensation. The PEMF, you won't really feel much of anything except for maybe a buzz. The RR2 feels like a massage as far as when it's working the scar tissue and adhesions. So yeah, no, there shouldn't be any pain at all when we're doing these therapies on you. Does insurance cover treatments? I don't know. It depends what your insurance is. So what we have to do is give us your insurance information. We can look it up to see what it covers or what it doesn't cover, because at this point I don't know if you have good insurance, bad insurance, poor coverage. The point of the story is we'll work with you whether you have good insurance, bad insurance, or no insurance. Either way, we're going to do what we can to make sure that you can get care and get back to doing the things that you like to do. If you're having knee pain and it gets bad enough, you won't do anything. You won't go outside. You'll avoid playing with the grandkids. You'll avoid going on trips, walking on the beach, whatever it is, anything that involves getting up and moving. And that's really decreased life status. Our goal is to get your life back, decreasing your knee pain naturally without having to get a replacement. So we have other options too. Say you don't have insurance or you don't have a lot of money. We use a company called Care Credit or Advanced Care Financing. We use lots of different companies. So price range, typically from $200 to $400 a month for up to 12 to 18 months. Now you're not in here for 12 to 18 months, but that's just what a payment plan would look like with a company like Care Credit or Advanced Care. So most of our patients can afford care. Let's say 94% of our patients can afford care. It's not an issue. And if those that are, we give them other options, other avenues as far as that goes. How long until I feel results? Typically, we like to say 6 to 10, just to play it safe. But what we're doing is we really think we can get you a decreased pain in 3 visits. That's why we're kind of doing this video. That's why we're doing this promotion. Is With the exam, there's 3 free visits. What we want to do is we want to prove to you that we can actually help your knee pain. So the 3 free visits are about showing you that we can do it. Obviously treatment will be a little bit longer than 3 or even 10 visits, but that's what the 3 free visits are for, is to show you that you can be pain-free, you can have decreased pain from your current status. So what is the typical time frame for treatment? It really depends what therapies we're doing or what's needed that day. So typical time frame of how long you're in the office is usually about 3 months or so. Obviously seeing you more in the beginning, unless as the pain decreases and we start doing more functional things, as exercises and things like that. A typical visit can be between 20 and 60 minutes. Like I say, that varies on what therapies we're putting you on. And what we're doing that day. I would plan on 45 minutes at least, based on therapies and treatment that we'll be doing, either adjusting wise or RR2 rapid release or the Achmed, typically around 45 minutes at least per visit. So yeah, you hear this a lot too, is I have bone on bone or no cartilage, is there anything that can be done? Yeah, absolutely. And that's really what we're trying to get people to realize, is that even if you are bone on bone, there is relief that can be had. You can get back, from a 10 out of 10 to a 1 out of 10 or a 2 out of 10, barely any pain at all, any sensation. You can do the things that you want to do. So there used to be this preconceived notion that once cartilage or meniscus was gone, it couldn't regrow. Well, that's not true. They found, multiple studies show that yes, under the right circumstances, it can grow back. So that's why we talk about the average doctor 17 years behind on current research, literature, and technology. So we're not one of them. That's why we're doing this, because we have the most current information. We have the most current technologies and therapies that work for knee pain. So that's why we're here to help people. So do some research. You don't have to take everything I say as God's given word, because it's not. I don't know everything, but I'm going to tell you everything that I do know, and I want you to go online. I want you to do whatever you have to do to look it up to make sure that what I'm telling you is truth. And, you should do that with every doctor, your surgeon, your medical doctor, your dentist. Don't even get me started on amalgam fillings and all these nasty things that happen. Do some research. You're the best advocate for your own health. It's you. So yeah, like I say, people with bone on bone, they can't believe how much relief they get with treatment, because they've never been able to get relief before, or everything that they've done in the past hasn't worked. So long story short, if you have bone on bone, yes, there's absolutely things that can be done to decrease your pain level and get you back functioning like you want to and you're supposed to. So what's next? If you're already a patient, thank you for watching this video. We don't have time to sit down with everybody to go over every aspect of care with you. That's why we really encourage you to watch this, and we hope that you watch it with your spouse too, so that you're both on the same page. If you're not a patient, call our office. Schedule an appointment for an exam, consultation, and then, like say, the 3 free visits, so that we can prove to you that we can help you. So in closing, my name is Dr. Taylor Van Wyman. I want to thank you for watching this. If you have any questions, please send them to me at Dr. Taylor at drtaylorchiropractic.com. Our office phone number is 515-232-6318, and hope to see you soon.